Do I have fungal acne? That's the question that we're going to talk about today. Welcome, I'm Dr. Arthur Colsky, founder and medical director of Advanced Acne Institute. We're a dermatology practice specializing only in the treatment of acne. That's all we do. And we have various insights and experiences that we'd like to share with acne sufferers navigating the path toward clear skin. And we hope you find this information useful from an educational perspective, but this is not medical advice. So, do I have fungal acne? So this question comes up quite often at Advanced Acne Institute. A lot of patients feel that they have a condition that they term fungal acne. Now let's dissect this and discuss what this really means. So acne is a condition of inflammation around the pore. In the pore, there's a hair follicle and there is an oil gland, and they're attached together. And that's what you see. If you take a microscope and look deep inside the pore, you're going to see that. You're going to see oil glands attached to hair follicles. And acne develops because the hormones are stimulating those oil glands to become overactive, and a number of events occur, and bacteria grow, and inflammation occurs, and eventually the inflammation leads to a pimple on the surface, or blackheads and whiteheads develop as well. So that's how acne forms. Now, what is meant by fungal acne? So there is a condition called Pityrosporum folliculitis. And this is a type of a fungus infection that can affect essentially the same area. However, instead of the oil gland, this one is affecting the hair follicles that are attached to the oil gland. So it's basically inside the pore also, but it's not acne. Now, it can look sometimes similar to acne because it's developing inside the pore, just like acne does, but it looks a little different typically. So the fungus develops inside the hair follicle, and it causes the hair follicle to become inflamed. And little bumps appear on the skin surface, and they can look like little pimples. Usually they're very uniform in their appearance, and we call that monomorphic, which means that each one of those pimples looks the same. They're all little bumps on the skin, and they look like pimples, but if you look at them together, they all look pretty much the same. Whereas in acne, you might have some really big pimples, some smaller pimples, some blackheads, and some whiteheads. You see a variety of different shapes of pimples in acne. In this so-called fungal acne, you see this monomorphic or very similar pimples that develop. And they can develop on the body, they can develop on the face, and sometimes it's not readily identifiable. A lot of times it is. A lot of times just by looking, a doctor can determine whether something is acne or a fungal process. But sometimes it's not, and sometimes a little sample is taken to look in the microscope to see if we can identify the spores of the fungus inside the hair follicle. And that's helpful too. And the treatment can be different because we're not targeting the same things that we're targeting when we treat acne. So sometimes we'll use topical medicines that can have effects in limiting the growth of the fungus. And sometimes pills can be used, but typically a topical regimen can be useful. But overall, the first step is identifying whether this condition is regular acne or a fungal condition that needs to be treated in a little different way. And occasionally they can occur together. So I have seen patients with both of these conditions at the same time, which makes it a little bit even more complicated. But nevertheless, acne is the most common thing that we see as far as pimples on the skin. And occasionally we will see this condition called Pityrosporum folliculitis. So we just need to be sensitive to the fact that that is a possibility so that we don't overlook that when we're diagnosing a patient with acne.